Hello, and thank you for watching this video about supporting your health and well-being, an overview of research and strategies. My name is Chiara Dall'Ora. I am a lecturer at the University of Southampton in nursing. And yes, today, I'm going to give you a short, again, overview of the research and strategies that are going to be essential for you to maintain your health and well-being as a student or as a registered nurse. So first of all, let's start by having a look at why this is important. Well, it is important, I would say, first of all, because as a human being, it is a human right to be well, to be healthy, and to be in a healthy work environment. A work environment is key to your health and well-being. And what do we mean by work environment and a healthy work environment? A healthy work environment is one where staffing levels are right, where there's good teamwork, where the workload that you have is adequate, so you're not overworked, where you are involved, where you are autonomous as well. And a combination of all these factors together is then going to have an impact on how you feel at work, your health, but also your stress and your burnout, your satisfaction and your commitment to the job. And these in turn are also going to have a very, very important impact on your performance in terms of your sickness absence, errors and adverse events, and then organizational performance, so retention and patient outcomes. So basically having a healthy work environment is key for you to be well and then for you to perform well. So it's actually in everyone's interest to provide a really good and healthy work environment. But as we know, this is not really and not always the case in our current picture. We are, as an NHS, we're going through several challenges: the COVID challenge, Brexit, austerity, and all of these. It's been basically a combination of for a perfect storm, and all of those have put the health workforce and also the nursing workforce, of course, under considerable pressure. There's not enough nurses. Trusts are struggling to recruit enough nurses, and reports like that of the Royal College of Nursing that you see here on this slide basically are painting a kind of grim picture of nurses feeling that not having adequate resources means that they are not they're not able to provide the care that they want to provide. So if this is the picture, again, we know that it's not only this grim, but it can be pretty grim. So what could you do as a registered nurse or as a student nurse in these challenging circumstances? First of all, I'm going to start by telling you some of the most common, but unfortunately most unhelpful solutions to stress and, absence of well-being. This is a common one. Just do a bit of yoga and you will get better. Or even worse, actually, making you feel that nursing isn't for you if you cannot stand the workload. Actually, no, it's not your fault. Don't worry, it's not your fault for not being able to stand the workload. The workload is really, really high and too high for you. So it's not your fault. So if someone says something like that, just tell them that they're wrong. Toughen up. So it means that you're not strong enough or that you're not resilient enough. And resilience is really one of my unfavorite words, I have to say, because it's not a bad thing in and of itself. It's just how it's used very much recently, especially. So in the context of, considerable challenges that you as a workforce are experiencing, asking you to be resilient is really not the right solution, because it's not a matter of you not being resilient enough. It's actually a matter of the system not enabling you to even be resilient and to provide the care that you need. So I don't think the solution is to become more resilient, basically. So when they offer you a resilience course, I would politely decline, or you can actually take the course, but don't expect to see a big change in your health and well-being, because it's unlikely to happen as a result of a resilience course. And I think it's really, really bad to teach you only to be resilient, so without changing the work environment, because it places the burden on you instead of the negative work environment, which is the cause of your stress and absence of well-being. It expects you to hide who you are and what you are experiencing, and that is wrong. It's simply wrong. You are a human being and you're struggling, and that's okay. That's part of being a human being, and it's not about hiding that. And it is often an excuse for not improving things. It's used as a quick fix to avoid improving things. I really think in nursing we need a culture change. So this is an image that I really, really like. It's from some qualitative work that Lindsay Stiggy and Jessica Rainbow have conducted in the United States, interviewing a group of nurses, and basically what they found is that the super nurse culture in nursing is alive and kicking. So nurses, for example, don't take their breaks and don't stop to rest or to eat and drink, because they think they're strong. They think they've got these superpowers, extraordinary superpowers used for good. They've got the cloak of invulnerability. And I see this also, you know, when I'm teaching, especially final year nurses who are, final year student nurses who are about to enter the profession. You can really see this image. They view themselves as superheroes that are going to be able to stand everything. They're going to be able to be up on their feet for 12 hours without a loo break, without a comfort break, without a drink. So, but actually that's a superhero. That's something that doesn't exist in reality, because as a human being, you have these basic human needs that you need to fulfill during a shift. And so I think that we really need a culture change from the super nurse culture to the human nurse culture. So to actually embracing our humanity and our vulnerability as well. There's a TED talk that I really recommend watching. I invite all of my students to watch it, by Brené Brown, The Power of Vulnerability, and the beauty that actually comes from embracing your vulnerability. And also make sure you take your breaks. That's really important. Don't postpone them. And also ask yourself, am I safe to practice? So after going for like 8 hours on my feet with no rest at all, am I still safe, or am I starting to become unsafe to practice? And avoid long shifts if possible. A lot of the research that I have conducted, that I am still conducting, is really showing that long shifts have many negative effects on your health and well-being in terms of burnout and sickness absence. So if it's possible, if they're not mandatory and you can, I would suggest you avoid them and allow enough time to recover. And ask for help. It's actually not a sign of weakness. It's quite the contrary. It's a sign of being aware of your humanity. You could consider a budding system each shift to provide support, or staff huddles to check on well-being rather than on how the patient care is going, more focused on well-being. And these are some of the evidence-based strategies that I wanted to give to you. And all of these are taken from a paper that is going to be available at the end in the resources. And it's a discussion paper that Jill Maven and Jackie Bridges wrote about supporting nursing well-being. They wrote it for COVID actually, but the strategies that they offered actually apply in all contexts. They're not just confined to COVID. So they really recommend, and again, they draw a lot of literature together, and they recommend, of course, prioritizing your own well-being as much as possible. It might not be easy, but even trying to do simple things like eating, drinking, resting, sleeping, having some breaks, doing this, even just human basic things actually helps. And I would say also build compassionate teams, build communities around you rather than just being on your own. Even when you are unwell, try as much as possible to build compassionate teams. And here are just some examples of behavior. So first of all, remember the names of new staff members rather than saying, oh, the student, or oh, the agency nurse. I don't know if it ever happened to you as a student to be called, to be addressed as the student rather than with your actual name. I expect that wasn't pleasant for you. So if you can, please try and remember the names of everyone who is on the shift with you, who is working with you. And give positive feedback to others. You have no idea how much that can make a big difference to someone's day. So having a colleague or a student even just saying, you know, I think you did this really well. I'm impressed. I learned a lot from you today. I think that makes a really big difference and helps other people's well-being too. And notice when others are not feeling at their best and work with them to support them. So even becoming aware of other people's health and well-being makes a big difference. Ensure they also get breaks and support during the shifts, and help people, try to help people understand how to deal with their situations rather than just giving them direction, saying, rather than telling them what to do to solve their problems. Just try to help them understand. And then there's one I really like, the double tap, and there's a video again, it's a YouTube video that I recommend where this doctor actually talks about health and well-being and burnout in the NHS staff, and she recommends the double tap as a source, as a strategy, basically, where you ask someone, how are you? And when they reply, most of the times they will reply, I'm fine. And then actually say, but how are you? So asking twice, how are you, rather than just once. That can be a really good strategy to get people talking. And then try to be a neutral, curious and compassionate witness and stand in non-judgment and just be with your colleagues. Use opening statements and questions. And here are some of the good questions. So what have been your greatest challenges or frustrations? What are your greatest rewards or successes? What does it mean to be in this team for you? And if you don't know how to respond, say something like, oh, that must have been incredibly hard. I can't imagine how I feel in that situation. So don't try to say, yes, I understand, that's awful. Just emphasize that you cannot even imagine how hard it is for them. And if you want more information, say something like, sounds like you've experienced something that nobody should have experienced. Can you help me understand how that's impacting you now? So these are just some examples, but as I said, that paper by Jill Maben and Jackie Bridges really offers a lot of really useful strategies. And as I said, evidence-based strategies, so that's good. And then my favorite one, actually, even when you're feeling at your lowest, you can still be a change agent. First of all, by recognizing that bad is not the new good. Bad is bad, and there's no point in pretending that it's good. And actually, all of the biggest scandals and tragedies in the NHS have occurred when staff started to think that bad was the new good, that poor care was the standard, there was nothing else they could do. Actually, there is something you can do. First of all, I would say know the evidence. Again, I know you're gonna be very stretched with time and busy and will want to, rightly so, rest. But having some quick overviews of, for example, the impact that having unsafe staffing level has on patient care, that's really useful, because then you can also collect data from your unit, from your ward, from your service, and double check if the staffing levels are too low, the sickness absence is too high, the patient incidents are too high, and basically by collecting this data and having, again, an overview, not necessarily a detailed one, overview of the evidence, you can then escalate to the appropriate people in your trust, or even higher up in your trust if no one listens to you in your trust. But it's really, really important that you know these pathways to escalate. In every trust, there's gonna be yes, a document that basically details this escalation process. And lobby if you want to unite with other people, to lobby for change. That's great. I think there's power and there's safety in numbers. So if you want to do that, that's another good strategy. And speak up. Don't be afraid of speaking up, because, as I said, you can be part of this change. And if not you, who? So I'm really, really looking forward to seeing what you and all of our future nurses can contribute to in terms of providing really safe and high quality care to our patients. So these are some of the references, but don't worry, as I said, there's gonna be a link I'm gonna be offering the handouts, so you can access these references. And that was all. Thank you very much